here to frighten anyone. Most symptoms do not turn out to be worst case scenario, but there are some symptoms where it is safer to transfer to an emergency department, act early to make sure everything is okay. For some conditions, time does matter. Coming in early can be the difference between a full recovery versus long-term disability or even life and death. So firstly, the question that might confuse all of you is, what is an emergency consultant and what do we actually do in an emergency department? So an emergency consultant, an ED consultant, emergency medicine specialist, they're all names for what I do, and essentially we specialise in the primary assessment of urgent and serious health problems. Our job isn't always to make the final diagnosis, but it is to work out who is very sick, who needs immediate treatment, who needs to come into hospital and have a period of treatment and observation, and who can go home with a follow-up plan. So this photo is of our resuscitation bay, and this is a big part of what happens in the emergency department, resuscitation. So that means treating people who are critically unwell, people who are about to die, will come in. This can be a wide variety of things. We see a lot of trauma, so people who have very big car accidents, and they can have head injuries, so bleeding in the brain, bleeding in the chest, bleeding in the abdomen or the tummy, which means that they need urgent intervention, urgent surgery, and we facilitate that. There are other serious things like heart attacks, strokes, serious infections, major injuries from falls, pneumonias and severe infections. So bad that people might not be able to breathe and need to be hooked up to a breathing machine or a ventilator. And this is what our primary job is in the resuscitation bay. So this is the corridor as you enter the emergency department. And this is the second part of our job, risk assessment. At any one time, as an ED consultant, we're overviewing at least 100 patients. Some people are very unwell and need to be seen quickly. Some have worrying symptoms. Some might have painful syndromes, but less dangerous problems. And my job is to constantly prioritise who needs to be seen first, who can safely wait, and who needs urgent treatment before their condition deteriorates. So let's start with how to get to the emergency department. There's two main ways. One, call 000, an ambulance turns up and a paramedic brings you to the hospital. The second is you drive yourself or have a friend or family member drive you. Now there is a common misconception that if you call an ambulance, you will be seen faster. That is not true. Whether you come by ambulance, whether you have your friend or family drive you in, you will all be seen at the reception by a senior triage nurse. That nurse will have had 10, 20, 30 years of experience and a lot of training to have a look at you and decide how quickly we need to see you. They use something called the Australian Triage Scale, which is used all throughout Australia, and they decide you need to come in now because you're about to die, or we have some time to wait. And depending on that is where you get moved in the emergency department. If you walk into the hospital with severe symptoms, we will still see you before we see someone else who is well, who's come with the paramedics. That's not to say you shouldn't call an ambulance and you shouldn't call 000, and there are several concerning presentations that we will talk about today where you definitely should call 000 even if there is someone available to drive you to hospital. The main reason to call an ambulance is if you have symptoms of a life-threatening problem. If you are too unwell to get to hospital yourself, or if you need treatment along the way. Examples of this are things like if you have symptoms of a heart attack, if you have symptoms of a stroke, you can't breathe, you have a severe injury or a fall where you can't get up. In these cases, call an ambulance. Do not get anyone to drive you into hospital because if an ambulance gets to you, they can initiate treatment immediately. But please don't call an ambulance thinking that you're going to skip the queue. The ambulance isn't a fast-track ticket. It is for situations where you need urgent help, monitoring, or even treatment before you arrive to hospital. So this is outside our emergency department, just before the entrance. And as you can see, we have it extended for quite a bit. I couldn't fit it into one photo, but we have several ambulances, some police cars, all lined up, waiting. You might have heard in the media about long wait times and ambulance ramping. Ramping happens when an ambulance brings a patient to the emergency department. However, the department is full, so there's no beds for that patient to come in. We will look at you, the triage nurse, me as the ED consultant will look at you and decide whether or not you need to come in immediately because your life is at risk. And if not, unfortunately, you'll wait in a corridor with the paramedics. If you get worse, or if there are any concerns, we will bring you in as soon as possible. Unfortunately though, this means that we've got ambulances waiting in our corridors. We have paramedics waiting in our corridors to drop patients off for sometimes hours and hours at a time, which means that these are ambulances that should be out on the road servicing the community and helping people who need it. This is one of the reasons we ask people to use the emergency department wisely. If you have a serious symptom, please come. Our doors are always open. If you are unsure but worried, there are places you can seek advice. 13 Health, 13 Medicare are excellent resources where a senior nurse answers the phone and can give you some advice. And that advice might still be come to hospital. But if it's a problem that's minor and can be managed by your GP, a pharmacist, or an urgent care clinic, that might be a better option. Now I want to get to some common emergency presentations that are important for all of us to know about. So the first presentation I want to talk about is a heart attack. You may hear doctors use terms like a STEMI, a non-STEMI, acute coronary syndrome, angina, unstable angina. These words all mean the same thing, a heart attack. These are all different problems that involve blood supply to the heart. So the heart is a muscle. Just like all of the other muscles in our body, the heart needs blood and oxygen supply. The heart is supplied by small blood vessels called coronary vessels. And if any of these blood vessels is damaged or blocked, it means that the part of the heart muscle will start to die. That's what's called a heart attack. And you can have grades of heart attacks. You can have a small heart attack where only a part of the heart muscle starts to die, or you have a big heart attack where unfortunately a huge part of the heart has died. All of these variations are concerning, and all these variations need to come to hospital. If you do come to hospital with symptoms concerning of a heart attack, we act fast. It does not matter how many people are in the emergency department, we will bring you in and get the treatment that you need as fast as possible. At the hospital I work at, and most hospitals around Australia, we have something called a code, a STEMI code, or a code heart attack. And that means if we know you're coming and we think you might be having a heart attack, we don't wait. We call the cardiologists, who are the heart specialists, and we get them to come into the hospital in preparation to receive you, so that the time of you getting to the hospital to getting your treatment is minimal. Our goal is for it to be under 15 minutes door to door. Because time is hard. Because we don't want you to suffer from your heart attack. Now there are different treatment options for a heart attack. One is blood thinning medicine that they give through a drip in your arm, but the other is an intervention, which is up on the screen, called a PCI, or a coronary angiogram. And this is a time critical procedure. So this is why We don't care if we accidentally get the diagnosis wrong. We'd rather bring them in to save someone's life and be wrong than not bring them in and miss the opportunity to save someone's life. So the cardiologists will come in and they do a procedure where they insert a tube, usually into your arm or your groin, and make it all the way up to your heart and unblock that coronary vessel so that your heart gets blood supply and it gets oxygen and it has time to recover. So that's all very well and good, but what are the symptoms that we should be looking out for? So the big symptom, as I'm sure you all know, is chest pain. We take chest pain very seriously, especially in the older adult. If you come to hospital, the first thing we will do is a tracing of your heart. Simultaneously, we will then do blood tests that look for damage to your heart. Chest pain, trouble breathing. If that chest pain is crushing, it feels like something's sitting on your chest. If it moves to your neck or your jaw, to your arm, if you feel sweating, if you have trouble breathing, if you feel lightheaded, as if you're going to faint, you call 000. The benefit here of calling 000 is the paramedic will get to you, they can do that heart tracing, and then they will call ahead to us and say, I think this person is having a heart attack, which then gives us time to say, all right, you're 20 minutes away, let's get everything sorted so that everything is ready by the time you arrive. The second presentation I want to talk about today is a stroke. So a stroke happens when part of the brain loses its blood supply. The most common type of stroke is when a blood vessel it's kind of like a heart attack of the brain, where part of a blood vessel that's supplying the brain has a clot in it, and therefore that part of the brain dies. So this picture I have is a patient who's unfortunately had a very big stroke. This is a CT scan of someone's brain, and it should be symmetrical, so it should look the same on both sides. But as you can see from the arrow, where there's a darker portion of the brain that's dying, because this person's having an extremely large stroke. This person's stroke is affecting half their body, so that means that if we don't treat them, they won't be able to talk, and they won't be able to move their arm or leg on one side. This is serious, and I said time is heart, but time is also brain. So if you have symptoms concerning for a stroke, and you call an ambulance, the paramedic will again assess you, and then call us and say, I think this person is having a stroke. We put out a code stroke, and again, get the stroke physician, so the specialist, to come in. Again, doesn't matter if we're wrong. We'd rather them be there to greet you, and then the stroke specialist and myself will sit in the CT scanner with you, looking at the pictures to decide, yes, they've had a stroke, it's go time. We need to get this treated. And the treatment for a stroke, again, is a clot-busting medicine that can be put through your veins, or another procedure where they unblock the blood vessel in your brain. The symptoms of a stroke are a little bit more subtle. So things like slurred speech or changes to your speech, weakness in one side of your body, in your arm and leg, but also your face. So if you notice that you're with someone and they try to smile, but one side of their face is drooping, that's concerning for a stroke. There's an easy acronym which the Australian government uses for stroke, which is FAST. FAST stands for F, face. Has their face or mouth dropped or drooped? A for arms. Can they lift both arms? S for speech. Is the speech slurred? Are they making up words, or they can't find the word that they normally would be able to? And T is time. Like I said, brain is time. So if they have any one of these symptoms, face, arm, or speech, call 000. There are other stroke symptoms that are not included in this, which are important to know about. So if you suddenly can't see, out of one eye or both eyes, if you suddenly feel dizzy, like the world is spinning around you and you're going to fall over, if you can't walk, you might see people leaning to one side when they walk because that leg is weak. That's all concerning for a stroke and a reason to call 000. The important thing with these symptoms is if you have any of these symptoms, don't wait to see if they get better. Call 000 and get to the emergency department as fast as possible. If your symptoms get better by the time you get to the emergency department, there are still tests that we want to do. We still want to see whether or not you had a mini stroke and what we can do to help you from it becoming a real stroke in the future. The third presentation is pneumonia. So shortness of breath is one of the most common reasons older adults present to emergency department. It's chest pain and then trouble breathing. Shortness of breath is a very broad symptom. It can be caused by nearly anything. We talked about shortness of breath can happen if you've had a heart attack, but it can also be as a result of heart failure, a chest infection such as a pneumonia. If you are a smoker, there can be changes to your lung that make you unable to breathe, blood clots in your lung, and severe infection. Pneumonia is specifically a quite severe infection that affects a part of your lung. So this is a chest X-ray of someone who has pneumonia, and as you can see, there's two lungs and the heart in the middle, but then on your left, there is a white area that's not symmetrical with the other side. That's infection. So that's a really bad infection because it looks like probably 50% of that lung has turned into infection. This person probably can't breathe very well and is probably quite unwell. If you have a pneumonia, your body isn't getting the oxygen it needs, and you might develop a risk of that infection moving elsewhere in your blood. That's why if you have any of those symptoms, and adding to that things like high fevers, cough, where you're coughing up lots of phlegm, and often the phlegm is not necessarily white or yellow, but brown or red or green. If you're not eating and drinking properly because you're so lethargic, call 000, we'll see you and give you IV antibiotics, so really strong antibiotics through the drip, some fluids, and keep an eye on you for a few days so that we can make sure that things are getting better. The fourth presentation is falls. Falls are extremely common and they become more serious the older we get. Partly this is because as people get older, their bone density reduces and our risk of osteoporosis increases. So if we fall over, we're more likely to break something, and the consequences of breaking something can be quite severe. To prevent the risk of falls, please stop climbing up ladders over 1 metre or 2 metres high. Do not clean your gutters yourself. Outlie that to someone else. The number of people we see over 65 it would be a good idea to clean their gutters and then fell over and comes to hospital with significant harm. That can be avoided. There are lots of dangerous activities that we do that we need to stop doing as our bones get more brittle and are unable to support those forces. A fall might seem simple, so it might be that you tripped over something and fell over, but it can still cause significant injuries. Broken hips. Broken hips need urgent surgery within 12 to 24 hours, and the complications that happen after your broken hip can be very serious. You can get fractures anywhere, your arms, your legs. Rib fractures are particularly bad, because if you fracture your ribs, it then becomes really hard to breathe. And if you're not breathing well, you're at risk of having more complications like pneumonia, we talked about before, and even having your entire lung collapse. A very serious complication is if you hit your head and you have bleeding in your brain. That's very concerning and often needs to go for urgent neurosurgical intervention. And finally, spinal fractures. So our spine runs all the way from our head down to our pelvis, and the spinal bones are there to protect our spinal cord. Our spinal cord sends nerves out to our whole body, which allows us to walk, talk, move, feel. And if you have a broken spine, While the spine is not a problem itself, it can then damage the spinal cord, which means you could end up paralysed. So if you fall over and hit your head and have pain in your neck or your back, please stay still. If you're on the floor, stay still, call 000, yell out to someone to call 000. Because if you have a spine fracture and you move, there's a risk that you make that injury worse, which could end up becoming paralysed. When the paramedics get to you, they'll put a neck collar on you to protect your spine, and they'll very carefully transfer you in a way that's safe for your spinal cord. When you get to hospital, we will see you in our resuscitation bay that was earlier in the presentation. We will have a look at you head to toe. We will do lots of x-rays, we will do CT scans to figure out what could be broken so that we can get you treated. Second part of it is that falls aren't that simple. You might fall because you tripped over, but often as we get older, other things go wrong with the body that cause us to fall. So you can have an underlying heart problem, a heart rhythm that no one's known about, and that's caused you to have a fall. You could have an infection that you didn't realise you had, and that's made you a bit lightheaded, dizzy, and then you had a fall. So when you come to hospital, we will look for your injuries, but we will also do investigations and ask you a lot of questions to figure out why you actually had the fall, so that we can try to prevent it from happening again. The fifth and final presentation is infection and sepsis. Sepsis is a severe reaction to any infection. It can start from an infection anywhere in your body. A pneumonia, so a chest infection, can lead to sepsis. A skin infection on your foot can lead to sepsis. Anything where bacteria is in your body can then result in it leaking into the blood, causing sepsis. And the reason this is so bad is because sepsis can become life-threatening very quickly, because it means that there's bacteria floating everywhere in your blood, which means it affects every organ, and you can develop what we call multi-organ failure, which is when all of your organs start to fail. Your kidney fails, your liver fails, and eventually your heart will fail. Warning signs of sepsis include fever, feeling cold, shivering. You might find at night time you're sweating through your bed sheets, even on a day like today. You're confused, have severe weakness, can't breathe properly. Notice that you're not passing as much urine. You might feel mottled, or just generally you feel quite unwell. In older adults, the sepsis might not be that dramatic. It literally might just be someone's a bit confused. You might notice that a friend is confused or just not themselves, and that could be sepsis. So if someone's drowsy, confused, unable to walk, much more weak than they normally are, or not themselves, call 000 to bring them into hospital. In the emergency department, sepsis treatment involves lots and lots of different investigations, so blood tests, x-rays, testing your urine, so that we can figure out where the original infection came from, and then we will give you strong antibiotics, fluids, oxygen. We might need to give you stronger medications to keep your organs alive. Before I finish, I want to give some more practical tips about making the emergency department visit safer and smoother. So this is me on shift, on an evening shift with some colleagues. There was a cyclone that hit Brisbane last year, and as a result, myself and my colleagues had to sleep in the emergency department to be prepared for potential victims of the cyclone to come in. But if you do come to the emergency department, there's a couple of things you can do to make your visit smoother. Firstly, if you're on medications, even if you remember exactly what tablets you take, what doses you take, and when you take them, it's useful to have them written down on a piece of paper or a card, as well as your allergies, your GP, your next of kin, and have it in your wallet, in your handbag, on your phone. If you come to hospital, you might be confused, you might be unwell, and we don't know what medications you're on. We can find out but it's not as easy as people think. Unfortunately, not all medical practices around a state have access to each other's records in a timely fashion. So small things like that, particularly if you're on blood thinning medicines or diabetes medicines, we need to know immediately. The second thing that you can do is bring things like your glasses, hearing aids, walking sticks, dentures. These are small things, and if you don't have them, we can supply things for you, but having them can make a very big difference. Thirdly, and this is probably the most important one, if you get to an emergency department, even if with a simple problem, please tell the nurses straight away if you are on blood thinners. So if you have any heart problems, you're probably on blood thinners. If you have diabetes, if you have a pacemaker, or if you're immunosuppressed, or have had recent surgeries. Blood thinners are things like warfarin, rivaroxaban, apixaban, these medications, because knowing these things can change the trajectory, and it might mean that you're more unwell than you present. Finally, trust your instinct. Your job is not to diagnose yourself. That's my job. I've been to school and done a lot of study for a very long time to do that. But your job is to recognise when something is not right and to seek help. The key symptoms I want you to remember are these: chest pain, stroke symptoms, so slurred speech, facial weakness, arm weakness, pneumonia symptoms, severe shortness of breath, and serious falls, and then any change in behaviour, so confusion, they're not just quite themselves. If these happen, do not wait, do not sleep on it, do not wait to see if it gets better, do not drive yourself into the emergency department. Call 000 and we will be happy to see you.